Good afternoon, ma'am.
First, we'll see the rest of the slides from the previous session. Then we'll move to the new slides. Now I'm going to share my screen. Can you all see my presentation?
Yes, ma'am. We can see your presentation.
Okay. So in the previous session, we studied about the care plan. Normally, we are telling it as a nursing care plan. Why? Because the management that we are providing for the patients in the hospital-based setup, the nursing management is the most precious one, because we are not only focusing on the physical symptoms of the patient. In addition to the physical symptoms, as a nurses, we are focusing the psychological, emotional, spiritual, social, as well as the financial background of the patients. And we are providing care in all the, we are including all the compartments into that, in addition to the physical management. That's why in health and social care setups, the care that we are providing to the patients by nurses are the most important one when compared to the medical management. That means the management that we are only focusing on to heal the physical symptoms. So in the previous session, we studied regarding the definitions, but don't worry, you no need to memorize all those definitions, but you know what this nursing management is telling to you. So normally the nursing management, it is a kind of clinical judgment and the critical thinking. Those are followed by each and every nursing officers, which are most prominently focusing on the not only the individual, that means not only the patient, along with the patients, they are focusing on the family. They are focusing on family, friends, and as well as the public. So here the North American Nursing Diagnosis Association, we are simply telling it as NANDA, is one of the most important accreditations which each and every nurses who are registered and working in all over the world are comply the guidelines proposed by this NANDA, and we are working according to this NANDA in an international form. So this NANDA, it proposed one definition for this nursing care plan or the nursing management. In addition to this, the American Nurses Association is also another standardized institute, which is also providing a definition for this nursing management. So these are the most standardized definitions that we are using to define the word nursing process or nursing management or the nursing care plan. And also we studied regarding the importance of nursing process, why we need this nursing management. And I explained to you regarding with if the difference between if we have the practice of nursing management, what will happen, and if we are not having the practice of nursing management, what will happen. So the major or the basic concept of using this nursing management is for the care provision of the patient. So we are focusing on identifying the patient needs. So what are the patient needs? Immediate care needs of a particular patient, both physically, mentally, emotionally, socially, even culturally, what the patient needs. So we are identifying them, and we are providing the care in an effective and an efficient manner to improve the quality of life of a patient. So that is the major purpose of writing and using this written document. And also it is important for the nurses as well, because with the help of this nursing care plan or this written document, the nurses also, they can develop their professionalism, and they can provide a best nursing care to the patient, and they can reduce their they can use the energy effectively and the time management. So for all these are the basic concepts that we are using for developing the nursing process. And the characteristics, yes, there are different characteristics are present within this nursing process. So first one, it is a structured way. So I already showed you the way of writing the care plan. So we are putting a chart which contains 6 elements. So that is the way of writing the care plan. It is there is an organized framework or structured way of writing a care plan. And it is a kind of problem solving method. Yes, it is providing solutions. Mainly it is a patient centered care, patient focus, not the professional focus, it is the patient focus, and it is having some sequential steps. So there are 5 steps are present. So according to that 5 steps, we are providing and we are planning a care to the patient. And it is a goal oriented. Goal oriented means, so we are identifying what is the patient problem and we are having one outcome. So according to that outcome, to achieve that outcome only, we are planning our activities and we are implementing to achieve those outcomes related to the patient health status. Yeah, it is a dynamic one. That means not each and every patient having the same nursing management. According to the patient body condition, according to the patient psychological conditions. So we are identifying the patient problems and we are formulating according to the patient problems which we are identifying. Wait a minute. So according to that, we are planning and we are implementing all the actions. So that's why for each and every patient, the problems and the symptoms, physical conditions are changing. So we are finding those conditions and we are formulating. That's why we are telling it as a dynamic. Dynamic one means it is always changing, not a fixed one. And yes, we for this developing this nursing care plan, you need to have a critical thinking process, not a normal process. It should be some kind of critical thinking, and it is a standardized one, universally standard one. You can apply in any country. It is not confined to Sri Lanka or not confined to one state of Sri Lanka. So when we take the whole world, whenever or wherever you are going to work in any countries, we can apply this care plan for the patient concern. So these are the characteristics of the nursing care plan. And the advantages, what we can gain by writing this care plan. Yes, similarly, as I already told you, so we can have or the patients, when we are talking for the patients, they can get a maximum best quality of care which they are needed, and they can fulfill their immediate care of needs with the help of this nursing management. And also when we are talking about the professionalism, so when we talk about the professionalism, it enhances the nursing practice. So the nursing professional and the practice of nursing, it can enhance by using this nursing process. And also it emphasizes the patient's dominant care. What are the patient's immediate? What the patients immediately need. So with that, we can provide that immediate, we can fulfill the immediate care of the patient. And also when we are talking about the patient professional side, it is the nurses, they can work independently. So they no need to stress what they did because it is a kind of written document. So whatever they did previously, they can show up. These are the things I did for this particular patient. If there is any problem arise, also they can show it as an evidence. So these are the things I did for this patient. I am the responsible one for this. Likewise, they can show it as evidence. So as this written document, the nurses also itself, they can work freely without any stress. So independently, they no need to rely on other nursing professionals or other supervisors. They can work independently. It is also another important advantage when we are talking about in case of professionalism. And also it increased the care quality. The quality of the care also increase. So these are some of the advantages that we can gain by having the practice of writing the nursing care plan. So these things we studied in the previous session. Today we'll see what are the components. So what are the elements of this nursing care plan. I already told you we are giving another name for this nursing management as a nursing process. So process means, yes, it is having some sequential order or step. One by one, we are doing these things. So this nursing care plan, it is combined of 5 major process. So first one is the assessment. So assessment, we already know that is the major part of this module. Assessment means gathering information. So what are the ways that we are following to gather the information? There are different assessment types are there. So when we are talking about the nursing assessment, so what are the guidelines or what are the methods that we are using in order to gather the information from the patient? That is coming under the assessment. Diagnosis means what is the problem? So normally there are two different types of diagnosis are there, medical diagnosis and the nursing diagnosis. Whether it is a medical diagnosis or nursing diagnosis, wait. Can you all see my screen now?
Yes, ma'am. We can see.
Okay. So whether it is a medical diagnosis or nursing diagnosis, commonly the diagnosis means a problem. So what is the problem present in this patient? But when we talking about the medical diagnosis mainly identifying the physical problems. So for example, once you go to the physicians by complaining about I'm having a fever or I'm having some little dizziness, I fainted today morning. So for likewise, you are complaining and you are going to see the doctor. So after the doctor prescribes some investigations like that, sometimes the doctor asks you to take some blood sample to get some investigations. Then you are getting the results of that and again you are showing it to the doctor. So after analyzing that report, then the doctor may tells, okay, you are having diabetes mellitus or you are having hypertension, high blood pressure. So likewise, the doctor will uh, tell some condition. So that is we are telling it as a medical diagnosis by only identifying your physical problem. So you are complain, I got fainted. So or you are having increased blood sugar level. So likewise, they are only focusing on the physical problems and they are identifying what are the major disease condition you are having. So these high cholesterol level or cancer or whatever, those things we are telling it as a medical diagnosis. So it is a problem. But when we talk about the nursing side, we are, in addition to this medical problem, we are identifying what are the other problems the patient having. Other problem means whether the patient is having any financial problem. So think about one situation. So one patient, a male patient, he is admitted to the hospital setup and he diagnosed with the cancer. So the doctor, he informed that the patient is having a cancer. So in that situation, so doctors, they only convey the message to the patient and they will go. But when we are seeing the nursing side, we are not only focusing on the patient physical condition. In addition to this, we will ask how the patient is feeling now. So whether he is accepting his disease condition or not. It is a kind of psychological side. So how the patient is feeling. So how the patient feeling means we are focusing the emotions of the patient. And sometimes the nurses, they ask the patient to express their feelings. Whether they need to cry, okay, they are asking to cry loud. Or whether they are in a depressed mood, they are asking, are you feeling okay or not? So time to time they are asking after convey the message to the patient regarding the physical condition or the physical diagnosis. And sometimes the patient may tell that he is the only one who is providing income to the family. So because sometimes he may have 2 or 3 children and he is only working and the income is only by him. In that state, he starts to worry about the future, the children's future. So once he died, how his family will be, because the mother is also not working and if she is also not capable of doing work to lift up the house environment, then he will get suffer. So he will think of that, how their children's future will be, whether the once he die, whether the mother only can bring up their children to some certain position. So those things he will start to worry. And the financial background, if the patient is not having enough financial background, then he can't go some kind of surgery. So if they are not undergone for the surgery, then they will end up soon. So those things they will start to worry. So as a nursing officers, we are the one who are spending more times with the patients in each and every ward setup. So every nurses, when they are providing care, they are asking about their financial background or what about their psychological conditions. And in addition to that, sometimes at the end of life care, we are having some end of life care means the patient is at the end stage. There are no, because all the management we provided to that patient get failed, and now uh, the patient is receiving all the cares at the end of the patient's life. That means the patient life will be 2-3 months or within some weeks. So in that situation, the nursing officers, they are asking whether you are having any wish to fulfill at your end stage life. Some older people, they may ask to have some religious chants or some religious activities according to their religion. So in that situation also, the nursing officers, we accepted that one, and we are conveying the message to the high authorities, and we are arranging like chants or any other period like that. So we are arranging in the hospital setup. So, but when we talk about the physicians, doctors, they are not coming and they are not focusing all those things. Just they are writing and they are prescribing the medications. But we are focusing on all the items. And if the patient is having any financial backgrounds, then we can instruct the patients to talk with the social care worker. So there are some welfare associations are there. Then we are educating the patients to meet up that social welfares, and they can have some helps for them. Likewise, and when we talk about the cancer patients, normally once the patient started the chemotherapy treatment, it is common they start to lose their hair. The hair, they start to have the hair falls. So at some after some period, the whole hair will fall off. So they become bald. So in that situation, we can educate them to have some wigs, or we can make some appointments to the people who already go through this cancer, and after the treatment, how they are feeling. So we can arrange. So these are the activities done by the nurses. So that's why we are telling that when compared to the medical management or the medical care plan, the nursing care is the most important. So far you can identify that here, even with one problem identification, we are identifying so many things. So it is important rather than treating the physical symptoms. So diagnosis means we are identifying whatever the problems the patient is having, we are identifying those problems. So once we identify the problem according to the patient situation, according to the patient health and social psychological condition, we are planning whatever the activities or whatever the actions we can do to help this patient. So that is, we are telling it as plan. Under the planning, whatever we can, we are planning all those things. So we can talk with the doctors, or we can talk with other healthcare professionals if needed, or the social workers. So whatever we can do, we are planning with the other. So it like a multidisciplinary team. We are telling it as a multidisciplinary team. Multidisciplinary team means we are formulating a team which contains not only the nurses or doctors, even other healthcare professionals, social workers, some public agencies. So we are involving all the people in one team. That is, we are telling it as multidisciplinary team. So planning, which includes all this multidisciplinary team in order to provide a best outcome in a patient health status. Implementation means, yes, so we are imposing whatever we plan, we are imposing to the patient condition. And also implementing means we are not under the nursing care plan. We are planning much as possible. Whatever the possible situations are planning are there, we are planning all the things. But when we talk about the implementation, sometimes the patient may recover with one or two planning methods. So the planning, the first and the second planning, once we implement those first and second planning, the patient may starts to heal up. Or sometimes you need to implement all the plannings that you plan for that patient. So there are some difference, but under the implementations, we are going to impose or we are going to imply what are the things that we planned under the planning. And evaluations that we all know. So evaluation means so far how the process is going on. So whether with our planning and implementation, whether the patient body condition improved or whether it worsened, whether we need to implied more. So likewise, we are evaluating. So under this evaluation, so it can be, the evaluation could be by the professional observation or by the patient's verbalization. So professional observation means, so you are not asking anything from the patient and we are observing the patient condition. So for example, if the patient is not a conscious patient, fully bedridden patient and the patient is not conscious, in that situation, patient can't talk. So we are observing the patient health conditions by using some parameters like on the very first day of the patient body condition. For example, we can tell the pulse rate is very, very low, like 60 or whatever, very low. But after your management, sometimes the pulse rate could be increased to the normal. So it is one of the indirect parameter. That means through the parameters, we are confirming that whether the patient body condition is improving or not. So it is professional observation. The nursing officer or the physician, they are observing the patient condition. Patient verbalization means we can ask. So we can go to the patient and ask how you are feeling now. What about your pain? Whether your pain improved or not, or still you are having pain, or whether you developed any other new problems. So likewise, we are asking and the patient replying to us. So it is patient verbalization. So there are two methods of evaluation we can do in the nursing process. So these are the 5 major components which we are putting in a chart form, a structured form for writing the nursing management. So here the first assessment means it is a systematic process that we all know. Normally, whatever the assessment, it is a kind of systemic process which we are used to collect the data. So in the nursing part, in the health and in the health care part, we are telling or we are dividing the data or the information that we are collecting from one individual as a objective data and subjective data. So what is this objective and subjective data means? Here you can see. Subjective data means what the patient is telling to you, what the client telling to you. So you are working as a care provider to one patient. So once you are working as a care provider and you are asking, okay, what is the problem you are having now? So tell me, sorry, you are asking from the patient verbally. So then the patient starts to tell, okay, I'm having the pain in my arm. Oh, so here she is telling my arm is itchy. So she is telling my arm is having some rashes. So like that, without observing, you are asking from the patient. So you are getting information maximum by encouraging the patient's verbal. That is, we are telling it as subjective data. So the information gathered with the help of the patient verbalization is subjective data. Objective data means, as I already told you, by checking the parameters or by checking the patient's conditions, we are telling. So here, this physician, so nurse or doctor, so he is palpating the pulse of this patient and checking. So the pulse measurement done by this physician is a objective data because the professional, we are not asking anything from the patient. As a professional, we are observing the patient body and we are getting some information. So that is the objective data. So when we talk about the healthcare, we are using this subject, we are collecting data in two forms, as a subjective form as well as the objective form. Focus on gathering information about client's state of well-being, functional ability, physical status, strength, and response to health problems. So these are the things that we are collecting in a form of subjective and objective data from an individual when we are talking about the healthcare setup. Okay. So how we can have the patient health assessment? So I already told you, okay, we need to collect one information. Then how we can gain maximum information without having any interruptions or without left anything important. How we can gain maximum information from the patient? Why? Because all these assessment are, they are very, very important, because not only to treat the immediate problem, with the help of this assessment as a written document, we can use this in a future problem as well. So for that purpose, the assessment part, it is very, very important. So how we can have the health assessment of the patient? Normally in our setup, we are having two parts. One is health history, other one is a physical examination. Health history, under the health history, normally it is a kind of patient verbalization. So here both subjective and the objective data collection are present. That means for your simple remembrance, you can have subjective data means patient verbalization, objective data means professional observation. So here also health history, the history collection or the history taking comes under the patients or the patient's verbalization or the subjective data. Physical examination comes as a professional observation or the objective data. So these two combined and we are having a full or the complete and accurate assessment. So to take a complete health history or to take a complete subjective data, we are having a guideline. Under the guideline, there are some components are there. So just answer to that component is enough to get the major activity. So because we are having some format in that guideline, we are having a format. So each and every components or the elements of this format having some set of questions or some set of parts. So you can use that parts and you can formulate the question and ask from the patient. So then the patient will reply to their question. So those replies will come as an answer for each and every components present in the part. So we'll see what are those components that we are using to get subjective data. So health history, it is a record of information about the patient's health, and the detailed health history is important for planning and effective management. So these are the guidelines or the format of history collection. So first one is you can demographic data or it can be biographic data. That means the simple personal information of the patients. So under these personal informations, we are asking regarding what is the name of the patient, age, address, gender, and at what time and date the patient admitted to the hospital, and BHT number. Normally this BHT number in the hospital setup, we are using this BHT number. That is bedhead ticket. The detailed term is bedhead ticket. It is a kind of written document. Those written document is used by all the healthcare professionals. We are writing what are the management going on for the patient, what are the current health status, what are the problems, all the things we are writing each and every day. So those documents maintained by the doctors, consultants, and physiotherapists or radiographers. So all the things are implied or contained in that BHD. But when we are talking about the home-based healthcare setup, so if one nurse or any care provider going to home and they are taking care of one individual in a home-based setup, we are not using this BHD number. So for that purpose, we are having any other reference number. So you can use that reference number in the home-based care and in the social-based care setups like elderly home or the children home. If you are going to provide care in those setups, we are not using the BHT number specifically. So this BHT number you can only find in the ward setup. And in addition to that, we are normally asking the religion, nationality, occupation, marital status, and the ward number. So here you can identify even in the personal information we are getting about we are focusing on the religious part, the occupation. So with the occupation, okay, you can identify, you can have some assumptions what with the occupation, what would be the economical stability of the family will be. And if the patient marital status means, okay, whether the patient is a single person or whether the person is a single person, if the single mother or whether husband died or not. So those assumptions or those informations we can gather in indirect form without asking. We can have some kind of informations in a personal as a personal information. So first one is a demographic data. Second one, we are getting the complaints. Under the complaints also, we are having two parts. Complaint on admission and presenting complaint. So complaint on admission means we are asking from the patient, once you are coming for the first time to the hospital, what are the problems you had? Like what are the chief problems? So here one example you can have. A 53-year-old male patient was admitted to ward number 10 complaining about severe fever. And persistent means continuous vomiting. So he had fever and the continuous vomiting for 2 days. So once you ask from the patient, okay, now tell me what are the problems you had once you admitted for the first time to the hospital. Then the patient may tell, so when I am coming and when I am admitted, I had severe fever and I had 2 days continuous vomiting. And if you need more information, then you can ask that, okay, in addition to that, what are the other problems you had? Whether you had any pain or whether you had any uh, diarrhea. In addition to this, likewise, you can encourage the patients because you also need to provide some hints to that patient. Then only patient starts to reveal all the things. So if patient had any other things in apart from the fever and the vomiting, then patient may tells to you, yes, I had pain also. Or if there is nothing, then the patient may tell that, no, only these two complaints I had once I admitted to the hospital. So this is complaint on admission. Then we need to ask about the presenting complaint. So sometimes the patient are admitted 2 days before. So after 2 days of admission, okay, now what are the problems you have? Still are you having fever still? Or whether your vomitus or the vomiting improve or still you are having vomiting? Or in addition to the fever and vomiting, did you develop any new problems or the new complaints? So likewise, you need to ask if the patient developed any new thing, then the patient may tell, yes, previously I didn't have any pain, but after admitted to the hospital, now I am having pain. Or the patient may tell, now my vomiting reduced after 2 days of hospitalization. So likewise, the patient may tell. So why we are asking this complaint, then only we can plan our management. So once we identify the previous complaints and the presenting complaints, because so think about the situation on admission, this patient presented with the vomiting, continuous vomiting. So after that, so once the patient admitted, we plan to reduce the vomiting. So we plan all the activities, the drugs and other activities we are planning and we are implementing to reduce the vomiting. So after 2 days, again, we need to check why we can't continue that management continuously, because for the first time, the management that we plan for the first time is some kind of efficacy is low. It should be the, for example, the medications or the drugs that we are gave for the patients at first, the dose could be very, very strong, very high. Because why? The patient complained that he had vomiting continuously for 2 days. So we need to stop that immediately. The continuous vomiting for 2 days is not good. So we need to control it immediately. For in that manner, we will the doctor may prescribe a very high dose of medication or the very strong dose of drugs. But after 2 days, if the patient reduced vomiting, the amount or the amount of vomiters the patient had could be reduced. So in that manner, if you continue the same dose of medication, again, the medication itself starts to cause some another problems to the patient. So that's why after 2 days, or not only not after 2 days, I'm telling that each and every day or every time you need to ask how after any kind of management you need to check. That is a kind of evaluation. You need to have what the patient condition is now, whether it improved or not. So here I'm just as an example telling. So after 2 days of hospitalization, you are again going on asking the patient complaints. So what about the patient complaints are? Then according to that, we can manage the patient. We can manage according to that. Then it will be helpful. Then it will be helpful for us to manage and to change our management. Then the care that we are providing also will be efficient. So that's why we are getting the admission complaints as well as the presenting complaints. Third part is a medical history. Medical history means mainly we are focusing on the past medical history. Past medical history means sometimes the patient, what are the patient having the patient whether having any disease conditions. For example, here in this example, you can see patient has been diagnosed with the diabetes mellitus for past 10 years. So likewise, you can ask. So the common conditions, whether you have any, you can ask, do you have any health problems or the health issues in your previous years? So then patient may tell, yes, I'm having sugar for 10 years. I'm taking these kind of medications for the past 10 years, or I'm having high cholesterol level for past 6 months. So I'm on these drugs. Likewise, you can ask. So asking getting the information related to medical history, surgical history, why it is important? Because sometimes the patient, for example, the patient already taking sugar tablets for the sugar management for the diabetes. The patient already taking medications for 10 years, but although he is taking those medication now, or the suddenly his blood sugar level increased up to 400 or 500. So the sugar level about 500 or 400 is not good for health. Sometimes it can make the patient, it can cause the patient's all the organs to be damaged. So in that situation, if you asked regarding the past medical history, then you can identify, okay, the patient already having the diabetes mellitus, but still it is not resolved. The medication is still the medication is not good for resolving the diabetes mellitus. So then we are go through all the medications. What are the medication the patient is having now? And we can change according to that. Or if the patient only take oral medication, that means through the mouth tablets, then if it is not good and if it is not resolved, then the doctor plan for the insulin administration, insulin injection. So for that manner, we need to identify the medical history. Similarly, for the surgical history also, we are identifying what are the surgeries the patient undergone previously. So with the help of the surgical history, we can have, okay, and normally in a nursing, we are instructing the people or the students to get when on the they are the student nurses or the staff nurses, when we are following this guideline, we are when we are taking the surgical history, we are instructing them to name the surgery. Not all the patients are aware about the name of the surgery and the date and time, but once they undergone for any surgery previously, they may have some clinic books for that. So along with them, they may have the records, clinical records. So if it is available along with the patient, then you can check it out and you can mark it or you can include it in your past surgical history. Or if the patient is not aware and you also not find any records, then under the past surgical history, you can write, okay, the patient undergone for surgery. Likewise, you can have. We are having some written evidence, okay, this patient already had some surgical incision, because normally after the surgery, you can identify the scars. So with that scar also, sometimes it may also, after so many years, they developed new complaints to the patient. So for that, we are identifying the past surgical history. Here I have some example. So client undergone for lower segment cesarean section. So normally it is for the pregnant mother. So one pregnant mother admitted to complaining. So she is telling that, yes, I undergone for one cesarean on 29th of August at 6 a.m. So the incision means the cutting. So which position they have cut the patient body. So it is transverse incision. Normally, the mothers, they are not aware about all those things. But if it is a Caesar, then they may tell, yes, I undergone for the Caesar for the delivery. But they mostly, mothers, okay, they can have the date remembered because the date of their child birth date, no, so they can remember. But the time and all those things, most of the patients are not aware about that. So in that case, you need to check the clinical record. But if there is no any clinical record, it's okay. No need to focus or no need to stress all those things. So this is the fourth part. Allergic history, yes, we need to, for the allergy, we are focusing on food, not on food, plaster and medication. Most of us are aware about the food allergy. What are the foods that we are having allergies for? If you identify the patient is having any allergies, then you need to mention what are the foods, whether the patient allergies for brinjal or tomato or potato or pineapple, fruits or vegetables or any seafoods, any fish, crab or prawns, whatever the things you need to include them. And if so, if you can ask whether the patient having any allergies for medication, some patients, yes, they may have some ideas regarding the medication allergies. If so, you need to include all those things. So under the allergic history, whatever the patient is telling allergies for, you need to specify that. If it is foods, what are the foods? If it is a medications, what are the medication? And plaster, okay, what kind of plaster? And family history, normally under the family history, we are writing a family tree. Family tree means why we are writing for the easy illustration. So here you can see for the box instructed for the male. If the male member, we are marking as a box or rectangle. And if the female member or the female person, we are marking in a circular. If the person is a patient, so when you're talking, if they are patient, either they are male or female, you need to color. So if it is a male patient, the rectangular box should be colored. If it is a female patient, it should be colored. And if the person is dead, then it should be cut like this. So here the person dead, so but it is a male person, so the rectangular box we cut. And if it is a female person, then like this. So under the family tree, normally we are focusing like if the patient, for an example, if I'm the one admitted to the hospital, then the care provider may ask the information about my family. So under the family history, so here now I'm the patient. So here you can see, this is me. And this is my father or mother and father. So I am having both my mother and father are alive. So here my mother indicated by this circle and my father, he should be indicated by this normal rectangle without any filling. It is indicated. Okay. And if they had any disease condition, then they can mark it here. We are coloring. Okay. So then from my father and mother, this is myself. So I am the patient. and I'm having one sibling, elder brother or younger brother, whatever. And here you can mark how many siblings you have. So sometimes the upper portion may be, sometimes if my mother admitted to the hospital, then this part indicating my mother. So he is a female patient. Then it is a kind of tree. So we are telling it as a family tree. Normally we are writing the patient, focusing on the patient side. So here this is myself. So they are focusing myself and they are writing my father, mother and my sibling. Or if I got married, then no need to focus on the father, mother. Only focus on myself and my husband and my daughter or son. It's enough. So this is some kind we are using in a nursing management by to have a look at once. With this, you can tell, okay, these are the people involved in this family. And in addition to this, we are forming this chart. In this chart, we are writing who are the members, their names, and the age, gender, what about their marital status, occupation, and what their relation to the particular patient and the health status. So why we are using this health status specifically? Because sometimes some disease conditions are inheritance. They are coming. So for example, it is common that we are telling that if my father or if my mother had diabetes mellitus, that means sugar, then there is a high chances of getting sugar as a child. Or if I got diabetes mellitus, there are higher chances of getting for my children. So these words that it is commonly prevailing in our society. So if we tell that I'm having diabetes mellitus, immediately the other person may ask that, okay, whether your father or mother having diabetes mellitus previously, or in any of your family members having diabetes mellitus, sugar. So why? So those things we are telling it as an inherited disorder. Inherited disorders means it is coming or it is coming from generation to generation. If my father having diabetes mellitus and if I am not having, then there is a higher chances of getting to my children, their grandchildren. So likewise. So why? So if we have this health status, then we can have some assumption. Okay, so this person get diabetes sugar because any one of the family members is having. So there is a high link. Yeah, that's the problem. Or if none of the family members none of them are having diabetes mellitus, but this is the first person, then we can identify or we can go for any other management. So why? We can have some detail or we can get some more information. Okay, none of them are having, why this patient developed. So there should be another secondary problem present in that patient body. So for gathering those ideas and to get detailed information, we are using this family history chart. And under the socio-economic history, yes. So here we are focusing on what about the family, whether the family is a nuclear family or extended family. How about the income, whether the income is okay or enough for the family members. And what about the water supply, whether they are living in flats or whether they are living in a rural environment. How the waste disposal, waste management, and how their living expenses, all those things we are including in the socio-economic status. So normally as a care providers, these 7 are important one. So though these 7 up to this, from starting from 1st to 7, these informations we are getting from the patient by asking patient verbally. So the socio-economic history, all the things we ask. So those things we are up to 7, we are telling it as a subjective data. From 8 to 12, we are telling it as a objective data. Why? All these are coming under the parameters. So from 8 to 10, from 8 to 12, you all no need to worry in detail because these are not that much important as a for you. Okay, normally these are provided done by the nurses or the doctors. Okay, but you need to know what are the parts present here. So vital signs means we are just checking the parameters regarding patient's pulse rate, pressure, and the temperature. We are checking once the patient admitted to the ward. So these things we can identify. If there is any abnormalities, we can check. whether the patient is having abnormalities or not, or the parameters are normal or not. Investigation means your test reports. The reports, what the reports? Blood report, urine report, or any other CT, MRI. So those things we are included in this. What are the reports and what are the results of the patient? And medications, yes, what are the drugs? So once we take the patients, what are the drugs they are having? So the name of the drug, what about the dosage, like that we are marking. And under this management, we are using some special charts. If the patient is a diabetes patient, then we are using a diabetics chart. And if the patient complained about high fever, we are having this quarter-hourly temperature chart, an observation chart. Fluid balance, like dengue, if the patient is having dengue, then for the management, we are attaching this dengue management chart. So these are the things we are observing and we are writing in a form of professional part. So it is done by the professional observation from 8 to 12. So that is, we are another term, we are calling it as objective data. So this is the two parts comes under the history collection. From first to 7, it is a patient's verbalization, subjective data. And from 8 to 12, professional observation, it is the which we can tell it as objective data. In addition to 8 to 12, we are having physical examination. So physical examination means we are examining the patient. So the nursing officer or the doctor, we are examining the patient from starting from the head to the toe, the big toe of the patient. For each and every body parts, we are checking. We are checking the head, we are checking the eyes, nose, mouth, and we are writing whether they are in a normal way or whether they are in an abnormal, whether there is any abnormalities are present or not. This is, we are telling it as a physical examination. Physical examination, the head to toe assessment also comes under the professional observation. So as a healthcare providers, you also need to focus on the physical examination. Head to toe assessment means you need to check. So whether the patient hair is normal, whether when the head means whether there is any scars are present or dandruff present or lice present. So you can check. Or how about the eyes, whether the eyes are in normal or whether the eyes having any discharge. Likewise, we are checking the physical examination. So this is a kind of professional observation. This physical examination contains major 4 elements. So inspection means by observing. We are just observing the patient from head to toe. What about the hair, eyes? Whether the face is in a normal position. Over after the surgery or after accidents, sometimes the patient face may get swelled or the teeth may be loose. So whether, how about those inspection? Palpation means you can touch the patient body and feel some things like for example, if the patient body gets swelled, then you can touch and feel whether the patient body swelled or not. Or whether if the patient having any inflammation, that means if there is any infection, the particular skin area become hot. The heat you can experience. So by touching, you can experience, okay, whether the skin is cold or heat, like that. So percussion, normally this percussion, even the nursing officers, we are not doing. It is done by the doctors. Once you see, even in a cinema or films, you can see the doctors, they will keep their hands on the patient body and tap on the hands. So it is a kind of examination we are doing to identify whether the patient's body having any abnormal, internal body having any abnormal structures or not. Normally, it is not we are doing in our routine setups. Auscultation means hearing, whatever the things that you can hear. The heartbeat you can hear. You can hear the patient's heartbeat, whether it is normal or not. The breathing also we can hear whether the breathing pattern is normal, or if the patient is having any wheezing, the sound. Normally, the breathing sound we can't hear normal, but if there is any abnormalities, the sounds may be when they are breathing, you can hear a different sounds. So those things we are telling it as auscultation. So under the physical examination, so all the things are included for a complete physical examination. With the help of these things, we can get a perfect assessment. So by answering to all the each and every small questions or the components mentioned here, you can get a complete and accurate assessment. So that's why we are telling it is a accurate nursing assessment. So this is regarding the assessment. Okay, now tell me, are you all clear up to now? Or do you have any questions?
Clear, madam.
Okay. So here the next part is diagnosis. I already told you diagnosis means a condition. It can be a signs and symptoms or the problem. But what are the problems? Or what is the problem present in a patient body? The process of determining the nature of a disease condition by careful investigation of its signs and symptoms and history. So now we are identifying the problem. We are diagnosing the problem with the help of the assessment. Why? Under the assessment, you are getting all the maximum information from the patient. So with that, you can have, okay, what are the issues the patient is having? Those issues you are going to mention in this diagnosis. You are going to mention under this column. Okay. Nursing diagnosis, it is a kind of clinical judgment. We are judging what are clinically we are judging the patient. Okay. And it is not the judgment for the patient. You can judge family or the community responses to the health problems. It provides the basis for selecting a proper nursing intervention or proper implementation to achieve a best outcome. So yes, so with the help of the assessment, you are assuming or you are judging what are the problem of this individual family or community is having. So once you identify those problems, according to the problem, you are going to plan an effective management and then you are going to implement those management in order to achieve your health outcome. So this is, we are telling it as nursing diagnosis. So here you can identify the difference between medical and nursing diagnosis. Yes, medical diagnosis, etiology focused. Etiology means what is the cause, why this problem occurs. That is only they are focusing, not the patient concern. But nursing care, they are care focused. Okay, the patient is having these problems, but how we can provide a care in order to help the patient to overcome that problem. That is care focused. And mainly it is focused on illness. Illness means only the physical condition. What are the physical condition the patient is having? But in the nursing, it is focused on the person physical condition and their psychological, emotional, spiritual, and or in addition to the person, they are focusing the community as well as the patients along other members as well. And is specify the pathology. Pathology means the reason. So why this disease occurs and what are the why it increased or why it doesn't increase. Only the physiology of the disease. But normally when we talk about the nursing diagnosis, it is focusing on the patient signs and symptoms. All the signs and symptoms and patient care. Mainly patient care. And medical diagnosis, it remains the same for as long as the disease is present. Yes, medical diagnosis means if the disease present, if the diabetes mellitus present, okay, the identified physical symptoms are similar. Even it is a first day, second day, or the 100th day, if the diabetes mellitus present, the medical diagnosis, it will repeat the same signs and symptoms. Why? They are focusing on the physical illness. But when you are talking about the nursing diagnosis, we are focusing all the parts. So first day, maybe the patient may be very, very anxious, fear about the condition. But when you're talking about the 5th day, after he become used to all the investigations and hospitalization, and if his physical symptoms also little curing, then the anxiety also starts to reduce. So the care that we provided for at first for the anxiety or the fear to the particular patient, when we talk about the 5th day, the management could be changed. So that's why we are telling the nursing diagnosis won't remain same although the physical symptoms are present. because physical symptoms, the degree and the extent and the severity, if they are changing, the management that we are going to provide also change. So it is a dynamic one. So this is simple difference between the medical diagnosis and nursing diagnostics. So as for all, for you all, for keep in mind that medical diagnosis only illness focused, but the nursing diagnosis, it is for the care purpose, patient care. That is the basic concept between the medical and the nursing diagnosis. So normally as a nurses, we are having a format to write the nursing diagnosis. So under that format, you can express or expose all the things. First one, the problem. So what is the patient problem and why this problem occurs and how you can tell, okay, the patient is having this problem. For example, here you can tell anxiety means fear. The patient is fear. It's a simple example. So anxiety here, it is a problem. Normally, the problem statement or the problem that you identified from the patient comes at first. So next to the problem, it is why that problem occurs, the cause or the etiology. And the last part of the sentence is how you identified, how you are telling, okay, this person is having this problem. So once you take a sentence, first part of the sentence problem, middle part the reason, and the last part the evidence. So okay, you are telling that your patient, the patient that you are caring is having anxiety because of the first day of the hospital, because he never admitted to the hospital, and now the first time and the first day he admitted to the hospital. So definitely the patient is having anxiety or fear due to the hospital environment as well as the investigations that are undergo for him. So in that manner, first you identify the problem. So you are writing anxiety. Then you are identify the cause, the reason because of his hospitalization and investigation. Then you are telling, your evidence is patient tells to you. Patient may tells, I am very much anxious, or I am very much fear because this is the first time I am admitted to the hospital and I am not used to the hospital environment. At the same time, my family members are not with me, and the doctors, they are coming and asking so much of questions to me. So I am very much scared about my disease condition, like that patient expressing his feelings to you. So that is evidence, because you identify the patient is anxious because of the patient verbalization, the patient's talking. So this is your evidence. So here we have three parts: and problem statement, reason, and the patient evidence. Then we need to combine all these three words into one sentence. For the combination only, here we are using these two conjunctions. Related to, here related to and as evidence by. So for the short term, for the related to, we are writing R/T, and for the evidence by, AEB, as evidence by. So anxiety related to. So anxiety or the fear, it occurs due to or related to the patient hospitalization investigations. I am evidencing as evidence by patient verbalization. So this is the way we are writing if we find out any problems in the patient. And another example like fluid volume deficit. Fluid volume deficit means if the patient have continuous vomiting or continuous continuous diarrhea, then it is going in a fluid form, watery form. So the patient's, the body water content will be going to lose. It is common once you have it's normally you have experience, once you have any diarrhea or vomiting, they will provide Jeevani. Normally, we are telling Jeevani. For the Jeevani, they will instruct you to take more amount of water or Jeevani. Why we are taking this Jeevani and water? They are having very much content of water. So your body starts to lose water more. To replace that lost water only, the doctors or the in a normal routine, our family setup also, we are taking more amount of water. If it is not in a severe form, we are not admitting to the patient, but as a replacement, we are using that sometimes they are asked to drink more coffee because they are providing a kind of water. They are replacing the lost water. So if the water is losing, starts to lose more, then the body water content starts to reduce. So that reduce, we are telling it as fluid volume deficit. So why it is occurs related to continuous nausea and vomiting. How you can evidence? Normally, if the vomiting is continuous, then we won't eat anything much. We are not eager to eat. So decreased oral intake, and once you check the skin of that patient, the patient's skin become very dry. Normally, our skin are not dry. It is very smooth and it is very clear and shine. But once you start to lose more amount of water in your body, that particular person's body become dry. Once you touch the skin, it is very dry. And you can see the obvious scaly appearance. White color scales appearance could be seen. It is due to the loss of water content in our body. So this is how we are going to write the under the diagnosis column the problems. So here the major basic concept is we are prominently telling the patient's problem. Okay. So that is regarding the diagnosis. So once you identify the problem, now you are going to plan. Okay, so if the patient is having vomiting continuously and if he is not taking oral intake in appropriate manner, then you are going to plan. Okay, how we can instruct the patient or how we can increase the fluid content. So normally if the patient is not taking anything through the mouth, then we are providing saline. In the hospital setup, once you observe the patients, the bottles are hanging and through the line, we are sending some water content into the patient body. So it is normally, all of you may encounter this term that is saline, administering saline. So saline, why it is contains all the ions needed for the body and it is a water. So to replace the lost water, we are administering the saline. So you can plan, okay, we need to administer the saline to the patient. And also we can instruct the patient to take juice or any other fluids, that means water more or Jeevani. So likewise, you are planning what are the things that you can do or what are the actions you can undertake to stop that vomiting. Or if the vomiting is excess, the drugs are available, tablets are available, you can administer those tablets. So those are planning. Then once you planned all those things, we are implementing. Implementing means you are imposing. So you plan that, okay, we need to administer the saline. Then you are implementing. Saline was administered. Once you implement or once you do or once you did all the things, you are writing. Whatever the things that you did only, you are going to write under the implementation. Okay, the saline was administered or the medication was administered or the patient starts to take Jeevani through the mouth. All the things that what you all did, those things you are going to write under the implementation. Then evaluation, under the evaluation, okay, after your actions, after 1 hour or 30 minutes or 2 hours, again you are coming and checking and you are asking the patient, how about your vomiting now? Whether it is reduced or not. Then the patient may tell, oh yes, after taking the drugs, my vomiting reduced. My vomiters reduced. Then you can write, okay, the patient vomiting reduced. Or after 5 days of hospitalization, you are again coming and asking the patient how you are feeling. Still, are you scared about the hospital environment? Then the patient may tell, no, now I'm used to it. And I can, because all the healthcare professionals, they are caring in a very well manner. So now I am not scared. Then you are writing, okay. So when compared, because from the first day when you are carrying, you put one care plan. You wrote one written document. After 5th day, again you are writing one written document. Then they can compare. Okay, first day the patient got scared, but after the 5th day, now the patient is not scared. Then for the 6th day, your management, the management that you did through for this 5 days, it should be going to change for the 6th day. Why? Now the patient is not having any anxiety or fear. Now 6th day, no need to focus on the patient scaring because he is not having. So 6th day, there is no any management, no any plan. So this is how you are going to write the evaluation path. So that's all regarding the nursing management. So this is the way that if you are going to write a written document, you need to mention these things. Name of the patient, age, gender, we are normally writing on the top of the chart. So in addition to these 5 steps, we are writing the date and time. At what date and time you did care for the patient. And assessment, normally you can write not all the things, you can shorten and you can write the important things that you or information you gain from the patient. Under the diagnosis, we are writing all the problems that we are observed, and according to each and every problem we are planning what we can plan. And once you plan, whatever you did according to the planning, we are writing, and then we are evaluating. So this is, we are telling it as a nursing care plan. And why we are mainly focusing, why we are having our main focus on this, because when compared to the medical care plan, it is very, very effective, efficient way. That's why we can use, and no need to worry. There are some exceptions. When we talk about the normal caregivers in the hospital, the home setups, they no need to follow it in a deep manner, but it is best when they are follow this one. So once you are going to work as a caregiver in any health setups, not only in the hospital, even in a social setup or in any community-based setups, it is better to have a kind of care plan like this. Then it will be used for you and it will be more helpful for the patient care. So this is regarding the care plan. So are you all clear up to now? Or do you have any doubts? You can ask. The people that who are following the caregiver course, I think you may be familiar with this already, but others, sometimes it will be new to you, the words that I explain. So if you have any doubts, you can ask now, or you can go through the session. And if you developed any doubts in future also, you can ask me. If you're not having any doubts.
No,
Sorry?
ma'am.
It's
No,
clear,
ma'am.
ma'am.
You can carry on.
Okay. We'll move to the next part. Okay. So this is another part. So in this session, so these are the learning objective of this presentation. So at the end, you can here we are going to see a major 2 types of assessment. So in the very first for the assessment module, once we started the assessment module, we studied about the what is this assessment means and what are the types of assessment that are commonly prevailing in health and social care setups. In addition to those assessment, today also we are going to see 3 assessment. One is use-led assessment, needs-led assessment, and single assessment process. So this use-led and need-led assessment, both of them are assessment type, and the single assessment process, SAP, it is a kind of assessment tools. So we already studied as a separate lecture the types of assessment tools that we are using. In addition to this, the single assessment process also available. Also, we are going to see about the CARE program approach. So this CARE program approach is a kind of policy. It is a legislative framework which we are using for the assessment purpose. And the importance and the types of models. What are the models that we are using in order to apply the assessment? So these are the major 3 learning objective of this session. So we'll see one by one. First, we see the user-led assessment. So what is this user-led assessment? So the basic concept is patient-centered care. So the other word for this assessment is a patient-centered care. So here we are mainly focusing on the patient or the client. The individual's opinions are given dominant status in the assessment, and accountability for decision made are a mutual concern with the individual. Yes. So when you are gathering information from the patient, you are focusing on the patient. If the patient tells that I'm not willing to tell this information to you, then you can't force the patient. You can't compel the patient to tell, no, you need to tell these things. Otherwise, I won't provide the care. So those words you can't use, because according to the user-led assessment, we are mainly focusing on the patient needs and patient approaches. So how the patient is approaching you, and what are the patient's needs now. Likewise, we are mainly focusing on the patient. And if the patient not willing to tell his private information, it's okay. You can't force him. You can convince him. So you can, with your polite words, you can convince the patient, and you can make the patient to accept your request, and then you can ask the questions, but you can force him. So you can't tell that if you are not providing information, I won't provide the care. Likewise, you can't provide. You need to develop some kind of mutual relationship with you and the patient. It is, we are telling in that form, you are gathering information. We are telling it as a user-led assessment. And in addition to this, whatever the decisions made by the patients during the user-led assessment, he is the accountable one. The professional is not the accountable one. That means sometimes some private information from the patient is needed for the care plan. If the patient tells, no, without that care, I'm not going to tell. If you are not providing the care, it's okay, but I won't tell those information. If the patient made those decisions, then he is the accountable one, because the professional, because they ask all those things. If he is not going to do, or if he is not going to work together, then the accountability should be goes to the patient. This fact contain organization care meetings, determining who should be involved, and establishing the recording and reporting on the assessment conclusion. So here, normally the patient centered in the user-led assessment, the patient, he is having the all the authority to choose who is the care professionals going to treat him, who is the person going to record all his informations, and whether the patient can involve the family members or friends in the care professions, or when they are making any decisions, whether the patient is the only one having all the authority to make the decisions for his care management. So this is, we are telling it as a user-led assessment. So informations we are getting from the patient mainly depends on the patient concern. Okay. Needsless assessment means here we are not focusing on the patient's decisions. We are not begging the patient, just tell me, or we are not accepting the patient words. Mainly in the needsless assessment, we are focusing on what are the patient's immediate need, what the patient needs immediately. So we are focusing on the patient's needs, and we are going to work according to them. The assessment is based on the requirements of the patient support and care, not what resources are accessible. Yes, this is another part. So although you are, so for example, the patient may needs to have saline. Okay, the patient needs to have saline immediately. Why? Because he is having continuous vomiting. It is one example. But the patient is having vomiting, but no need to put the saline. Even by administering Jeevani, while asking the patient to take Jeevani time to time is Okay, because the saline is not, because the vomiting is not that much severe. But if you are having enough amount of saline, you no need to put the saline to to that particular patient. Why? Because the patient is not having severe vomiting. With the oral fluid intake, he can resolve. Although you are having abundant saline, we are no need to inject the patient's body and no need to insert all the things into the patient body. Okay, so that is needsless assessment. We are focusing what the patient needs, what the care or whatever the resources patient needs, although you are having abundant of resources available. So if the resources available, okay, no need to use all the available resources on the patient. So first, so in the assessment, you are checking what the patient needs now. Needless assessment does not have to concentrate on an individual's sufficiencies. And also it is founded on a judgment of the circumstances that individuals might find themselves. So normally in the user-led assessment, we are asking the patient. We are focusing on the patient centered. Needsless assessment, you are not focusing on the resources, but focusing on the patient needs, what the patient need now. So these are the another major types of assessment coming under the types of assessment. And this is single assessment process. So we'll see what is this means. It is a kind of assessment tool which designed in a purpose to make that elderly people are treated as individual and they will be given the care that encounter their needs. Yes. So we had lot of assessment tools like pain assessment scale, Glasgow Coma scale, even for the pressure ulcer, we are having one kind of scales we have proposed. Here, this single assessment process mainly focusing on the elderly care. So we are checking with the single assessment scale with this tool, whether the elderly people are whether we are taking them into consideration, whether we are seeing them as an individual. We are accepting, okay, they are also a human. So wait. We are checking whether each and every elderly people, whether we are whether they are receiving their respect and their dignity, and whether they're receiving all the care that they are needed, whether they are fulfilling in a community wise, in the hospital wise, in the family wise. So whatever the form, whether we are checking or whether we are seeing them as a whole individual, and we are checking whether their care needs are going in a smooth, in a proper way. So for the assessing the elderly people care and the support that the elderly people receiving in one community, we are using this single assessment process. So the single assessment process is mainly focusing on the elderly people. It was planned to ensure that specialists operated and worked together in order to enhance the health and health status of each and every elder. Yes. So why we specifically focused on this or formed this assessment tool? With the help of this assessment tool, we are checking that whether all the healthcare professionals are involving in the care management for the elderly people, and whether all the specialists are working in a team, team, and whether they are providing a proper management in order to improve the health status of the individual each and every day. So this is a kind of process that we are using. Individual needs can be still evaluated, however, the process can be time consuming. Yes. So when compared to other assessment tools, it is a little bit time consuming. Why? Because single assessment process, with the term you can identify, it is a process. So with the time only we are checking. So from previously how the elderly people were treated, now how they were treated, likewise each and every time. So we are reviewing each and every time as a process. So it will be, it become a little time consuming. Each and every day we need to check how the family members are treating, how the community services are treating them, whether they are receiving all the community services in a proper way. So at one time, you can't get all the information like other pain assessment or the pressure ulcer assessment tools. So here, although it is a time consuming, it can provide some kind of important information regarding the elderly care. In that manner, we can provide good care in order to improve the health status of the elderly people. It will be more and more important for us. So this is one of the importance or the benefit that we can get from the single assessment process too. All elderly who need access to social services need to have a summary single assessment. According to the criteria, we are categorizing the eligibility. Who are the elderly people? We need to provide the care immediately. So critical means they are in a very, very critical state. They need the care management immediately. And sustainable means okay. They are some kind of at a risky state. Moderate means the care that we need to provide externally in a moderate manner because they are well settled and the family members are okay. And low means okay. The external, that means the community services and the care that they are getting from the outsiders is little bit very, very low. Why? Within the family members and even financially, physically, psychology, they are very, very healthy. So in that manner, the elderly people are considering as a whole individual and they are receiving all the care without any interruptions. So we are having this criteria. With this criteria, we can identify the risky and the more care needed individuals, and then we can provide the effective care for them in order to enhance their quality of life and well-being. So this is regarding the single assessment process too. So are you all clear up to now? Or do you have any doubts regarding the assessment type and the process?
No, ma'am.
Okay. Then we'll move to the care program approach. So mainly this care program approach we are using, it's a kind of policy, legislative framework, which we are mainly focusing for the mental health problem individuals and the people who are having learning disability. In other words, we can tell this care program approach, CPA, this policy originated a part of a Mental Capacity Act. So we already studied under promoting equality module, this Mental Capacity Act. So one policy that originated from this Mental Capacity Act is this care program approach. The approach used in secondary mental health and learning disability services to assess, plan, review, and coordinate the care, treatment, and support for people with complex needs relating to their mental health or the learning disabilities. Yes. So with the care program approach, the assessors who are assessing or who are providing care to the mental health people or mentally ill people or the people who are having learning difficulties, so they can use this care program approach in order to identify the problem and review the patient's conditions and providing the and plan the care and providing the care for all those things. It will be helpful for the assessor to assess in these kinds of people. The standard care used in primary and secondary mental health and learning disability services are used to treat, assess and review the people with more significant further needs. Yes. So here the care program approach we are telling as a standard care. Why we are telling it as a standard care? Because we are using both in the primary or the secondary or the tertiary setups in order to identify what are the needs of this patient, to assess the needs of the patient and to plan the patient needs and to treat them and to review their conditions. to those who are having very, very prominent or the immediate needs related to their mental ill and their learning disabilities. So that's why we are telling this care program approach as a standard care. Okay, so why we need, what are the purpose of having this policy, that care program approach? First one, it ensure a consistently high standard of practice in coordinating the care, treatment, and it will help it provide the support for the people who success the secondary mental and the learning disability services. And also it is providing a guidance or a framework for the staff who are helping in a clinical decision making about supporting the people. And also it helps to ensure the staffs are guided in a proper manner and they are working or they are providing all the care according to the principles and values. And also those activities undertaken by each and every staff should be patient centered. So they are providing a patient centered care recovery, and also in addition to that they are focusing on the patient centered form of assessment, planning and reviewing. And also it is set out the approach. This approach used to assess, plan and review and coordinating the care and support for the people. So the major basic concept of this policy, it is mainly focusing on how the staff members are working, whether they are following all the guidelines and also whether they are helping each and every mentally ill and learning disability people in order to overcome their problems. So how they are, and in addition to this, how the each and every staff members are identifying their problems and how they are planning, whether they are planning in a proper manner and whether they are achieving their goal in proper manner. So these are the purpose of the policy. Then we'll see what are the major elements or what are the major components of this policy. So it is patient and caregiver involvement in the agreement and review of the care plan. This may require the involvement of the patient's advocacy and if possible, patient full participation. Yes, so it is a kind of, we already told you that normally this CPA also a patient-centered care management. So according to the CPA, it is stating an agreement should be formed between the patient and the caregiver. So patient also involved, the fully participation of the patient is they're expecting more. So rather than all the decisions are made by the professional, they are involving the patient. At the same time, if the patient is not mentally well, on behalf of the patient, as we already did according to the Mental Capacity Act, they can have any well-wisher, family member or friends or whoever very caretaking of that patient on behalf of them, they can get into the care plan management for the particular patient. Full consideration of the assessment of risk of violence and a plan for the management of risk. This should include the things associated with public protection, child protection, and adult risk. Yes, so here another CP, according to this policy, they are mainly focusing on the risk assessment, whether the patient is having any risky exposure for the violence or any other risk are present. So why sometimes both could be happens, whether if the patient is mentally ill, the patient have the chances of get violated, harassed, bullied or abused. And although if the patient also very, very aggressive and not mentally ill, then on the other hand, the professionals or the caregivers, they also having higher chances of getting or exposed to harass and abusing in risky manner. So both the parties may get affected. So with the help of the CPA, we can assess. So for the child in the focus on public protection, child protection, adult risk. So we can assess about the risk state of both the parties involved. Full participation of all the members of the multidisciplinary team. Yes. So the people who are providing care, patient, doctors, physiotherapists, speech learning disabilities means speech pathologist, audiologist, or nursing officers, other social occupational healthcare workers, whoever the people involved in the care management, they should or they needs to be included in the particular multidisciplinary team. The production of a care plan which addresses the patient needs to which professional responsible for which action point when it is reviewed. Yes. And in addition to all those things, each and every healthcare professionals who are committed to do the things, each and everyone should be accountable for whatever the plan they are making and whatever the actions they did. It should be documented and it should be reviewed time to time. Then only we can have whether the staff or the healthcare provider working in a professional way in order to improve the health status of the patient. So these are the major elements comes under this care program approach. Then we'll see what are the principles. So what are the guidelines or the principle this care program approach is having for the staff, whether they are following or not. So first one is the patient-centered care. Yes, care and treatment needs to be focused on the needs of the patient and not for the organization or the professionals. Patients should be involved as much as they can involved in their care and management. So the patient-centered care, the patient's choice, or in other words, we can tell it as informed choices. We know what are informed choice and what are informed capacity. So in this patient-centered care, we are mainly focusing on the informed choices made by the patient. Second one is self-management. Encourage the patient to take more responsibilities for their mental and physical health and risk management plan. Yes, another thing normally we are telling the care providing to the patients, the care that we are providing to the patient in addition to improve their health and status, we need to make the patient to work independently because throughout their lifetime, they cannot be rely on the care that is provided by the healthcare provider. So the care providing, the care that provided by a staff also to some certain extent. So with that period, within that period, we also encourage the person to develop their independency, to do their activities, both in a physical, mental or whatever. So we need to improve their independence. That is we are telling here, self-management. So encouraging the patient to take care, to take more responsibility for their mental, physical health and the risk management plan. Respect the diversity and ensure the staff practice in an ethical manner and also to challenge the inequality and discrimination which were prevailed in a working environment. And also there needs to be ensured that any care or treatment interventions are likely to be benefit to the patient. Whatever the care or whatever the management undertaken by the nursing office, undertaken by the care provider, it should be always benefits to the patient, beneficial. Even the planning, even the care planning, they are making also benefits to the patient. Ensuring that all the elements of the patient's medical, psychological, and social care needs are coordinated in the care plan. Yes. So all the things should be included in the written document, which is in a care plan format. Effective therapeutic relationship. So a good relationship should be developed between the patient as well as the healthcare professionals. Enabling members of the multidisciplinary team to communicate and work together in such a way that patients receive the best care and treatment. So during the care management, the relationship that develops between the healthcare providers and the healthcare receiver, we are telling with a specific term as a therapeutic relationship. So why we are telling it as a therapeutic relationship? Because once the care management stopped, it needs to be terminated. Terminated means those relationship you can't take to the you can't take to the whole life term. Once the management or the care plan, it's over, then the relationship also needs to be terminated. That's why we are telling it as a therapeutic relationship. The relationship develops only for the purpose of care, for the patient care, to improve the health and well-being of the patient. So once this relationship, if it is an effective manner only, the care that we are providing to the patients also become effective. So that's why we are telling the effective therapeutic relationship be maintained. Caretaker are fully engaged in the process and their views valid. Yes, so each and every care member, the caretaker, they should be involved completely, fully. So without any discrimination, without any negligence, they should be involved, fully involved, both mentally, psychologically, physically. They should provide the care fully. Information will be shared but confidentially respected at all times. Yes. So you can share the informations. You can ask the informations from the patient, and if any reasons, if the patient's private information needs to be exposed, okay. But apart from that, apart from those instances, the confidentiality should be maintained. So both between the healthcare workers as well as between the patient. People will be treated with dignity and respect all the time. Yes, because respect and dignity, it is a basic right of each and every person. So when we are talking about patient, yes, one of the basic right of patients, each and every patient needs to be treated with dignity and respect. Services will work in partnership with other statutory, independent and voluntary agencies to deliver care and support that is person-centered and recovery-focused. Yes, in addition to healthcare professionals, if needed, in order to improve the care, support and recovery, they can have a good relationship with other agencies or other welfare societies, public communities, for the in that man. So a partnership could be developed in those with those people as well. So these are the major principles or the guidelines proposed by the care program approach. So each and every, even the healthcare professional, all the care receivers, they need to comply all these principles during their therapeutic relationship. Then we see to whom we can apply this. Who are the people they need to work according to the CPA policy? All the clinical employees and all the health and social care professionals. And in addition to the health and social care members, the employees who are included in care coordination, or the people who are leading the professionals, the people who are present in a high authority management of the multidisciplinarity, they also need, we can apply this. And in addition to this, the family members, in addition to this, the family members, other caretakers or care providers, relatives, and who are the welfare of peoples, we can apply to this care program approach to these peoples. Okay. So that is about the care program approach policy. So are you all clear up to now?
Yes, ma'am.
Okay. Now we'll move to the models of assessment. So models means there are some models are present which are expressing how we can do this assessment. So the models means they are a kind of applications we can apply in a normal routine practice to make our care or to make our work in a more enhanced manner. So those are the models of assessment. So first we'll see why these models are formulated and why these models are that much important when we are talking about the assessment in health and social care sector. First, with the help of these models, we can increase the emphasis on assessment in health and social works, particularly. Yes. So we can focus or we can increase the emphasis on the assessment, how we need to do the assessment, why these assessments are important. Likewise, we can increase the emphasize on the assessment, and those assessment, especially we can have the major concern about the risk assessment or the risk management. So with the risk assessment, we can go for the risk management. And also it increased the focus on recordings, how the recordings and what are the results that the recordings had produced of a number of standard forms which may be used by each and every healthcare professionals and also the other social care workers when assessing the health and well-being of each and every individual. And also these models of assessment, it is a kind of evidence. So we can use it as a evidence and we can use it as a values when we are providing a standardized care. And also it is underpinned by knowledge around current policy. When we are using these models, so these models, they are each and every time they are formulating according to the current knowledge, current practice, current policy. So once we are using these models, then we can update our knowledge. It will be helpful for each and every care providers to update their practice to the people, updated their care. So once the care and the support are updated according to the current or the modern practice, then the care efficiency, care proficiency could be effective. Then it will ultimately help the patient's health to improve quickly. So that is another major important. And other one is it will be helps to gather information gathered from the workers' perspectives, and therefore the outcome of the assessment can be influenced by the attitudes and values of the assessor. Yes, with the help of these models, some models, it is based on the professional observation. That means I already told you a kind of objective data, the information gathered only by the professionals. So once we use these models, as these models are formulated or created with the help of the current skills and knowledge, then the observation of the professionalism could be increased. So once the professionalism enhanced, then the activities and the support that are provided by the staff or the assessors also could be very, very much efficient. So for those things, we need this model. So these are the importance of using the models in an assessment phase. So there are three models are present. One is procedure model and questioning model and the exchange model. We will see one by one. So what is this procedural model means? It is a kind of systematic process set out by an organization or institution with criteria which identifies the eligibility, follows the rules and policies which dictates what the care receiver is entitled to. This approach also leaves a power imbalance as the social worker dictates what services care receiver is entitled to. Yes, so in the procedure model, it is a systematic process, and in this type of model, they are having some set of criteria. So criteria means it is mainly focusing on the professionalism. That means the professionals, they are having a set of criteria and they are the ones who are deciding what are the services that or what are the management that each and every patient or the client can get. Here, the patients, they are not having authority or power to make decisions or to make or to foster their ideas when planning the care. Only the healthcare professionals or the healthcare providers, they are having the criteria, and according to the criteria, they are setting out, okay, what are the care management that the patient needs. So this is one drawback present in the procedure model. Why? Because they are not focusing on the patient concern. It is only focusing on the institutional or the organization outcome. This is the drawback of, it is not one, it is a major drawback present in the procedure model. This model can provide only a short assessment, paying little attention to the individual's strengths and abilities, their individual rights and concerns about quality of life. Yes, as I already told you, it is only focusing on the professionalism. So the professionals are the head when they are managing the care. So as this only the professionals are making the decision. The assessment made by the professionals are very, very short. Why? Because they are focusing on what only they need to make the decision. They are not focusing on the patient needs of care. So the rights, the values, the patient's needs, concerns are very much neglected with this application of this model. The difficulty arises when information is collected on an individual by different professionals with different focus but stored separate. Yes. So here, each and as it is only applied to the concerning the professionals. So each and every professional will focus or will see the individual in a different manner, because they are not focusing the patient needs. They are focusing on their needs, the professional needs. So one doctor, he will come and he will focus on the patient's disease. Nurse, she will come and she will focus on the other physical symptoms. So physiotherapy means they will come and they will focus on the muscles and bones on. So likewise, each and every healthcare professional is coming and they are focusing on their each sector. So in that manner, the informations gathered by each and every person could be different, because the doctors, if they focus on the disease, they will gather only that information. Physiotherapy, only muscles and bones, they won't gather the informations related to the other body parts. In that manner, they can't identify or they can't get all the informations of the patient properly, only a specific one. If it is a specific one, then we sometimes, if they neglect the other problems, the patient may starts to the patient condition may starts to worsen due to the neglected problems. So this is also another drawback present in the procedure model. This result is an inadequate understanding of the total experience of any individual by any professional. Yes, as I told you now, each and every individual won't get the whole understanding of the patient health status. Mainly focusing in the process of gathering information rather than in trying to understand what the service user needs. Yes, so they are mainly focusing on the professional information gathering, not the patient needs. On a more positive, this systematic manner of collecting large amount of data has also contributed to the evidence base for social workplace. So although the drawbacks are present, one positive approach is, as each and everyone, they are focusing on the gathering information. Sometimes it will be helpful for the social workers to work. So if they find out more and more information, then they could identify some problems or some other needs, like financial problems like that they may encounter. In that manner, they can help or they can suggest to have the social worker collaboration. That is the only good thing that will be happens once you imply the procedure model in your practice of assessment. Other than that, all the others are drawback to the patient side. This is regarding the procedure model. Under the questioning model, so with the term you can identify. So here we are having a set of questions. So here they are focusing on the nature of the questions and how the information is used. Yes. So the questions that we are asking from the patients also, we need to be very, very cautious. So even when we are assessing the patient, we need to be very much concerned about the words that we are using in our question. Sometimes those questions may affect the patient's emotions or the psychological concern as well. So in the questioning model, they are mainly focusing on how the questions are developed, what are the questions they are asking in order to gather much information from the patient. By using this approach, problems and solutions reside with the individual, and the social worker's task is to identify the problems and highlights the most appropriate approach to resolve the issue. This approach can be seen as a power imbalance in favor of the social worker. Yes. So as a healthcare providers, if we are focusing on the type of and the nature of the questions means, so with that we are not gathered more information. So because once we remove all the questions, it is not inappropriate or it is not inappropriate. Like that, if we remove all the questions, then the important things that we need to get from the patient, we can't get. So the problems and the solutions all are present inside the patient's mind. It is reside individuals. So then we need to ask the patient to go for the counseling or go ask them to collaborate with the social workers. Social workers, they are not focusing all those things. Then they start to approach in a different manner. In that manner, they are the one going to identify what are the exact problems the patient having and how we can have a solution. So even we are focusing on the questions, even the questioning model itself having a drawback, because once we started to focus on the questions, then we won't get enough amount of an assessment. Okay. Then exchange model, it is ensures a partnership working, where the care receiver is seen as the expert with an understanding of any issues. Information gathered within this process is used to enable the service user to see their potential and resources available to meet this potential. The aim by developing trust and involving all parties is to seek a compromise. This focuses on a holistic assessment of the context in relation to the individual over time. Yes, so exchange model is somewhat a mutual understanding. It is a kind of partnership working between the care provider and the care receiver. That means the normal routine, the care that we are normally providing or that we are normally expecting to provide to the patient in a normal health and social care setups. That means we are keeping the patient as a major one, and the patient, we are asking the patient concern, ideas, and we are identifying what are the immediate needs of the patient. Then the healthcare provider planning and implementing all the actions according to them. And also they are developing a trust, a mutual therapeutic relationship. Then all the people who are involving in a particular relationship, working mutually, and they are gathering more informations. At the same time, they are maintaining the confidentiality, and they are working in a proper time management. So this is an exchange model. So normally in order to improve the health status and in order to support the patient to a very good range, it is important to use this exchange model, because procedure model, questioning model, they are not focusing on the patient concern. They are mainly focusing on the professionalism. So as a healthcare providers, it is not important. Yes, we need the professional observation, but the major concern should be given to the patient ideas. So patient centered. The care the care provided in a health and social care should be a patient centered care. That's what we want. Along with the patient-centered care, we can include our professional activities in order to enhance the quality of life. But whole care should not belongs to the professionalism. So that's why it's not belong to the professional part. So the best model of assessment would be the exchange model among the three models. So this is regarding the models of assessment. So those are the things that I need to tell in today's sessions regarding the other two assessment and the single assessment process, the importance and the policy that we can use for the assessment purpose, the care program approach, and what are the models available and why we are using these models in an assessment process, and which is the best model we can use or we can apply when we are gathering the information. So are you all clear, or do you have any doubts so far? That is the end of today's session. So if you have any doubts or if you have any ideas, you can ask now. So if you all clear, then we can wind up the session. Are you all clear? Or do you need to clarify anything?
Clear, miss.
So far you all don't have any questions. We'll wind up the session. I'll meet you all in the next week. Bye bye and have a nice week.
Thank you, miss. You too.
Thank you, ma'am.
Thank you, miss.